What challenges do mental health professionals face when it comes to right skilling? And how can these challenges be overcome?
Well, look, there are lots of tools, but sadly, most people are not trained to club together the tools to be used to seamlessly flow in and out when they're being used. I mean, in a session, you've got to be in flow. Today, doing therapy is almost like, like the navigation system in your GPS. So for example, your GPS has a method. There's a process it follows, right? The roadmap has already been charted out. It's tried and tested. Similarly, it's very, very important to have a roadmap or a framework for therapy too,
Mm.
which is again something that differentiates us at Meta Council. I mean, maybe I could elaborate on this a little. So, uh, on the framework, for example, in the framework that I use for making interventions, the I include strategies like the uncovering technique, the basic techniques, the motivational strategies, the interpersonal strategies, the cognitive strategies, exposure based strategies, spiritual strategies, humor based strategies, etc. And having so much ammunition in our arsenal helps us or me to identify and pull out the right skills and tools to address issues the clients would come up with. So, I mean, I remember there was one time when somebody had said, and I really found it very interesting when I was a young therapist, that if the only tool in your toolkit kit is a hammer, then you'll treat every problem as a nail and you're going to hammer it down, right? So, so we have more than 100 different right skills and tools. Now, for example, and if I say 100, then I just named some 7, 8 strategies. Now, under that comes, so for example, under the cognitive strategies, we have techniques like the compassion-based techniques, which have there we have truth-based techniques. We also, in the uncovering strategies, we have individual downward arrow, interpersonal downward arrow, the what if technique, and so on and so forth. And it takes us to 100. We have the luxury of using 100 different tools and finding and identifying the right one. But there's one disclaimer I want to put in here. If you have to be trained in all the steps and stages of the protocol to reach the strategic intervention stage, because you have to begin with melting away client resistance first. So, why I'm kind of saying this, throwing in this caveat, is because you may come across some of the tools I have named on in books or the internet or whatever. Setting up therapy is very, very nuanced and layered, and you can't just jump into methods and tools without having laid out, prepared the terrain and the ground, so to speak. Yeah.